A problem that frequently presents itself during a normal evaluation for a patient I'm seeing is a deviated septum. Not all people, not all patients are aware that they have a deviated septum. Some patients come into my office either with the complaint of nasal obstruction, or they'll even come in and say, I know I've got a deviated septum. I had my nose broken years ago and I'm having problems breathing. But there are other patients that come in with other complaints, and when we examine them, they have a significant deviation. And that deviation is not associated with trauma. It has to do with just a congenital formation. It's the way their bones formed when they were young. And they're unaware that they're having problems breathing through their nose. I can't tell you how many times I see a patient for some other problem. I look up their nose and they have a horrible deviation. I go, do you have any problems breathing through your nose? And they go, no. However, they might have snoring, they might have allergy problems, they might have ear problems associated with allergy, like eustachian tube problems where they can't clear their ears. And it's actually that deviation of the septum which is causing a lot of those symptoms. And it's not always nasal obstruction that brings them to the doctor. So it affects not only how you breathe in and out when you're just sitting there, it affects your overall stamina, because people don't realize it, but when you can't breathe well through your nose and you're either exercising and doing some other strenuous activity, you can't reach your max because it limits your breathing. People think they can just compensate by breathing through your mouth, and that's just not true. The other thing it really does affect a lot is snoring and/or apnea. Snoring and/or apnea are related. The driving force for both those entities is the pressure difference between the nostril and the windpipe. So anything that causes resistance to airflow between the nostril and the windpipe, such as a deviated septum or enlarged nasal turbinates, will definitely make those problems worse.